So what I'm going to do on Chirina is I'm going to do the Skin Health for Life, which is the monthly protocol, which is going to, it's still going to extract it, but it's going to give her this brightening, and it's part of the health procedure for the skin. Okay, so it's important that you do cleanse the client first, and that's really just to take off any makeup. Obviously the machine would take off makeup, but there's, you know, you really want to try and get at the skin as quickly as you can. So you just do a simple cleanse as you would with a normal cleanser. So you just need to moisten the skin first. So this is just Skin Suitable Simply Cleanse or Simply Clean. So you just apply this over the face. It's quick upward strokes. And then just a quick rub through because you don't want the serums to run into her ears or down her neck and things like that. Okay, so on men who have got facial hair, if they've got thick facial hair, you can go downwards. But on women, if you think most people want to have this lift, so you want to work in the areas of the lift. Then from the central points around the top lip, working away from the centre. And what I can do is I can't treat inside the orbital bone. What I can do is with the heel of your hand, you just pull that down. You can then treat it over the bone around the eye area. So that's that lower third of her face done. After the third, I'm then going to apply some serum onto her nose. This is just going to help deposit, soften any sebum that's there ready for the extractions. Okay, so that's stage one done. Now that is the equivalent of microdermabrasion. Okay, so that's all microdermabrasion does that exfoliation. It's actually better because we're actually pushing in the cleansers as well.
That's alright.
It wasn't painful, was
No,
it? No.
Just sort of cold in the face.
Right.
So what I'm going to do is areas of most concern, which is probably just around here and around the nose.
That's done more, didn't it?
It feels a bit like I've got sunburn in the face.
So now I've gone on to the antioxidants. So remember, this is vitamin A, vitamin E, white tea extract, horse chestnut extract, rosemary extract, and then hyaluronic acid. So here I'm now doing similar to the way I applied the peel, but I'm just catching the skin and pulling. So it's just pushing a little bit in. And what I'm doing now is I'm being much more meticulous to make sure I cover every area. Now we're going to move to the lights. Keep your eyes closed. We just put one over the middle of the mouth, and you use that to shut up annoying clients, but it's also for people that have got smokers lines or lipstick lines or kissing lines, or however they want to call them. So you hold that on, and we're just holding them for 30 seconds and do 2 passes. So it does actually quite improve smokers lines, but they need to do them quite regularly, you know, once a month at least, or ideally once a week for 6 weeks. So I'm just moving them slowly to try and cover the whole side of her face. I'm just going to do her left side and then her right side. If you can see the definition around her jawline here,
Yeah.
can you see how that's more defined?